A startling thing is happening in the United States. The infant mortality rate has reached a plateau, and maternal mortality rate has doubled since the 1980s. The United States is 43rd in the world for infant mortality rates, worse than Cuba, Taiwan, and the entire European Union. For maternal mortality rates, the United States is 41st in the world and is tied with Belarus. In a country that prides itself on technological advancement, the healthcare industry is falling short in delivery. Several studies have been done to find a cause for the stagnation in infant mortality rates, and there is a correlation between cesarean sections and pregnancy and delivery risk.
Why do women have cesareans and why are they dangerous? Women who have high-risk pregnancies generally get C-sections. A high-risk pregnancy can include, but is not limited to, a breech, preeclampsia, multiple fetuses, or limitations of a woman's pelvis size and shape. However, there is a rapidly growing group of women who are opting for a C-section. The freedom and convenience of scheduling your delivery is appealing to women and physicians alike. For example, women can plan to have their child on a holiday or a date that is important to them. Currently, 32% of live births in the United States are cesarean sections. Elective C-sections are popular with women, but are also popular with doctors. Whether a C-section is emergency or elective, a hospital receives between $5,000 to $15,000 more for a C-section than a natural birth. Also, a sped-up delivery time due to C-section improves patient turnover and opens more beds in the maternity ward. While C-sections are beneficial to a hospital and to mothers in emergency situations, there are complications many women are not aware of.
A little-known cause for last-minute C-sections is the use of labor-inducing drug Pitocin. Pitocin oftentimes causes fetal distress, causing the physician to perform a cesarean to save the baby. This drug, in addition to raising the number of C-sections, is also linked to autism and low APGAR scores. An APGAR score is a graded exam given to a baby immediately after birth to assess for defects or abnormalities. Even in cesareans without the use of Pitocin, babies born on average have lower APGAR scores than those born vaginally and have lower birth weights. In addition to complications for the fetus, cesareans could cause several complications for the mother. Some of the complications with C-sections are urinary incontinence, abdominal pain, uterine rupture in future pregnancies, hysterectomy, ureteral tract injury, and death. It is unadvised medically for a woman who has had a C-section to have a future birth vaginally. In essence, if you have one C-section, your choices for your birth experience are taken away for future pregnancies.
20 years ago, the World Health Organization recommended that a maximum of 15% of deliveries should be by C-section. Using this recommendation, the United States is performing more than twice the cesareans recommended. There is a lack of evidence for the benefit of non-essential C-sections, and there are several possibilities of harm to both the mother and fetus. Our role as nurses is to provide education about the risks and benefits of cesareans to future mothers in an unbiased manner, as well as to take part in and support research on birth methods.